First, let me extend my greetings to Rector Gianni Profita and the professors, students, and collaborators of UniCamillus University. Let me also commend you both for your ambitions, for your mission, and how you propose to go about accomplishing that mission. The world needs the talents of the international medical community to focus on the diseases of the South, the less developed world, diseases like malaria, HIV/AIDS, dengue, tuberculosis. As terrible as COVID-19 has been, more died last year from AIDS-related diseases, some 690,000, and from malaria, some 400,000. And let me commend you too for your business model, to use the American term, which provides funding for those in developing countries in ways which encourages them to return to serve their country. Perhaps the most important part of your mission is to ensure that your graduates become the academic core of the training centers that you plan to establish in the developing countries. Health is essential to overall well-being, but is also essential to economic well-being. One cannot have a healthy economy without a healthy workforce and a healthy populace. The needs in the developing countries are enormous. The scope for improvements are great. The challenges that you will face in accomplishing your mission are daunting. But as I've watched the development process closely over more than a half a century, it can be achieved with resolve, with education and training, and with research. So let me end my remarks with a message of hope and good wishes to the academic community and to the students of your university. COVID-19 has only underlined the importance of your mission. I want to share with you some of my thoughts about the effects of COVID-19 and the post-pandemic recovery. COVID-19 is a defining event of the era. It's the worst pandemic in a century, the worst economic downturn since the Great Depression. And depending on how it evolves and how its economic aftermath is managed, it could be as deep and long-lasting as that traumatic event. There is much we do not know about every aspect of this disease, including its long-term effects. But it's only because of advances in science and medicine that we've been able to respond as quickly and effectively as we have. Without those advances, the devastation would have been much larger. And it's only because of the advances in economics that the economic devastation has not been worse. One of the striking things about this pandemic is that some countries have done much better than others in containing the disease and death. Among the successful countries have been Vietnam, Taiwan, South Korea, New Zealand, Germany, and China. And on the other hand, some countries have done much more poorly than others. And unfortunately, among those countries that have done very poorly is the United States. The only one that has done worse is Brazil. Some countries have not contained the disease in spite of very stringent lockdowns. India is an example. Out of these successes and failures, we can learn a great deal about the disease and about our society and our ability as a society to contain diseases. One way of thinking about it is to contrast the success of New Zealand, a very strong democracy, and the failures in the United States. When I think about what is the reason that the United States has done poorly, one can categorize the failures into two categories. Those related to pre-existing conditions, including the preparedness, and those related to the response. In terms of pre-existing conditions, the United States has poor state of health. Among the advanced countries, we have among the shortest life expectancies. life expectancy, which today is lower than it was 5 years ago. But most importantly, we have the most health inequalities. This particular virus is not an equal opportunity virus. It goes after those who are in the poorest health, which are disproportionately among those who are the poorest in our society, including many people of color. One of the other distinctive aspects of the United States is that it has a poor system of social protection. For instance, there is no mandate for paid sick leave. The result of that is, without paid sick leave, many people who were able to work but still contagious went to work, spreading the disease and making the devastation so much worse. We also had a less resilient healthcare system. It was like we built cars without spare tires. We were proud of the fact that we were using every hospital bed. We had less excess capacity. But that meant when we had a surge associated with the pandemic, we were not in as good position to deal with it. But there's some other broader aspects of our society that are very telling. We have less social cohesion. Individuals had less respect for others. And the result of that was that they didn't wear masks. And that meant the disease spread. And there was less respect for science, especially from the government. I'll come back to that in a minute. But among the poor pre-existing conditions was poor preparedness. We always turn to government when we have a crisis. 40 years of attacks against government has meant that government was less capable of responding. But what has happened in the last 3 years has been particularly devastating. We disbanded the White House Office on Pandemics. We depleted the stockpiles. We defunded the Centers for Disease Control, the agency that was responsible for it. And that, of course, set the stage for the poor response. We needed a public response, but there was less trust in government. Or there was less competence in government. We needed to have quick recognition of the risks, but the leadership in Washington denied the risks. We needed to explain science, but the leadership in Washington attacked science. We needed to explain what economists call externalities. The leadership in Washington still doesn't seem to be aware of the full extent of the externalities. We needed to build a sense of cohesion for enhancing voluntary response to the externalities. The leadership in Washington increased the divides rather than increasing cohesion. We needed a coordinated supply response, for instance, tests, and we didn't get that. We needed to provide paid sick leave. And Congress recognized the importance, but the big companies acted in the usual short-sighted way and selfish way, opposed it. So half our workers were effectively exempt. And there's still, among the Republicans, opposition to providing support needed for the hospitals, tests, providing protective gear, and helping the schools. So it wasn't, though, just dysfunctions in the public sector. There were problems in the private. There was less trust in the private sector. It didn't even produce reliable tests. There was less resilience in the private sector. It was incapable of producing simple products like masks, let alone the more complicated products like tests and ventilators. Just as there have been large differences across countries in their ability to control the pandemic, the economic and social consequences of COVID-19 have differed greatly across countries. Some are having much larger decreases in GDP. Some are having much larger increases in unemployment. Some are having larger increases in unemployment relative to GDP. In some countries, suffering is much worse than others. Unfortunately, the non-COVID health problems are not being addressed in many countries, including the United States. Again, We have to ask why. And as we think about that and look across the countries, we can explain the differences both in terms of pre-existing conditions and the quality of responses. Those countries that performed well in health often did better in economics for much the same reason: greater social cohesion, greater trust, greater respect for economic science, greater competence to the public sector. Those countries did better. Similarly, the US failed because it had poorly designed policies that were poorly implemented, with a lack of prioritization, a lack of vision of what kind of economy we wanted to have post-pandemic. There's a lack of understanding of what would be required to get a strong recovery. There was a blind faith in the short downturn, followed by a V-shaped recovery. And the result of this was that programs were too short, not comprehensive enough, and they lacked the awareness of the underlying economics. There was a lack of awareness, too, of the difficulties of administering in the United States, a limited capacity of the UI system, our unemployment system, in contrast to many other countries which were able to get checks out very quickly, including developing countries. Argentina, for instance, announced on Tuesday that it was going to deliver money to children who were poor and needed it. And by Friday, the money was delivered. So there are lots of aspects of the failure of in the United States, differences between the United States and the successes in countries like New Zealand. And those are related to some of the same fundamental characteristics that were associated with a poor health response in the United States versus the very successful response in New Zealand. And what's needed now is a vision of the post-pandemic economy and society. Never has the public provided so much assistance to the private sector. It should use it to help shape the post-pandemic economy, both through who gets the funding and the conditions put on the funding. Interestingly, Europe and some other countries like New Zealand are doing a much better job in this post-pandemic vision than the United States. The pandemic is having a devastating effect on developing countries, both on their economy and on their health. There's not going to be a V-shaped recovery in the United States, in Europe, or in the developing world. It will be a long, hard battle. Critical will be getting the pandemic under control. Providing health care to these countries will be center stage, not only in this pandemic, but there will almost surely be more, and we have to be prepared. Healthcare, your work in these countries will be vital. We can't have a healthy planet, a healthy global economy without healthy citizens everywhere. That's why your mission and the mission of your university is so important. It's been a real pleasure to be able to share these thoughts with you today, and I wish you the best of luck.